Hi, Ruben here and welcome to Anatomy Movement, where anatomy becomes funatomy. We have summarized and detailed notes, acronyms, HD images to build your photographic memory, X-rays images, tabled notes and questions and answers at the end of each video to help you remember all that we have learned. Without further ado, let's dive into today's topic. Anatomy of the skull. Did you know that your skull is a great conductor of sound, which is why you hear your own voice differently when it's transmitted through your skull compared to external sounds? That was just a by the way. In skull anatomy we shall look at the following subtopics: functions of the skull, the cranium and its difference with the skull, the sutures of the skull foramina, the cranial cavity and relevance of the skull. Quick question. Below is an illustration of the facial skeleton. Which bone is highlighted in blue? Hint: it's the bone just above your cheeks. Stick around to find out. We shall begin with the functions of the skull, which include 1. Housing the brain, special sense organs, upper airway and proximal GIT. 2. It is a point of muscular attachments. And finally 3. It provides a mechanism for mandibular movement. The mandible is the lower jaw and it moves to allow for various purposes such as speech and mastication. You need to note that when the mandible is removed from the skull, we now refer to it as the cranium. So let's discuss the cranium. The cranium is divided into two main groups, the neurocranium and the viscerocranium. What's the difference between the two? The neurocranium refers to bones of the skull that house the brain and the cranial meninges, while viscerocranium refers to the bones of the skull that house the face. Getting back to neurocranium, it is divided into two subunits, the skull cap, which is also known as the calvaria, and the skull base. The calvaria refers to the topmost bones of the skull. Most of these bones are formed by intermembranous ossification. That is to mean that the bones are formed from ossification of a membrane. Most of these bones consists of two tables and a diplo. Examples of calvarial bones include parietal bones, squamous part of the temporal, occipital and frontal bones, and the greater wing of the sphenoid as well. It's important for you to look at these bones in an anatomy atlas so that you can familiarize with them. The skull base consists of thick bones formed by endochondral ossification. That is to mean that the bones are formed from ossification of a cartilage. The bones in the skull base include condyles, petrous and basilar parts of occipital bone, styloid, mastoid and petrous part of temporal bone, the pterygoid plates and greater wing of the sphenoid as well. The viscerocranium, as we said earlier, refers to the bones of the skull that house the face. They house some special sense organs in the face as well, such as eyes and nose. Some of the bones in the viscerocranium are pneumatized. This is to mean they have some air spaces in them known as paranasal sinuses. There are 4 paranasal sinuses which are important to note: the frontal, maxillary, ethmoidal and sphenoidal paranasal sinuses. The bones in the viscerocranium include the zygomatic bone, the maxilla, the mandible, nasal and lacrimal bones as well. I believe now you can answer the question we asked when we started, and that is the zygomatic bone is the bone just above your cheeks. Another quiz. Which of the following bones contribute to the calvarium of the skull? Sphenoid, ethmoid, parietal, lacrimal bone. The correct answer is parietal bone. Our next subtopic is the sutures of the skull. Sutures of the skull are simply the joints that connects the bones of the skull. Another question. The sutures of the skull are which type of joints? Keep on thinking as we proceed. There are 3 types of sutures in the skull. 1. Serrated or interlocked sutures. These sutures have numerous projections that interlock. For example, the sagittal suture that separates the 2 parietal bones. 2. Simple bore butt-end sutures. In these sutures, the margins of adjacent bones are smooth and they meet end to end. For example, the suture that separates the 2 palatal shells of the maxilla. 3. Overlap or beveled sutures. In this suture, the border of one bone overlaps the adjacent bone. This is mostly seen in the squamosal suture. The major sutures in the skull include the sagittal suture, the coronal suture, the squamosal suture and the lambdoid suture. It is also important to note the points where the sutures meet. For example, lambda is the junction between lambdoid and sagittal suture, while bregma is the junction between coronal and sagittal suture. Let's have a quiz. Complete the sentence. The frontal Fontanel represents the junction of the dash and dash sutures. The correct answer is coronal and sagittal suture. It is important to note in that question, that if one was asked dash and dash bones, not sutures, then the answer would change to frontal and parietal bones. We've mentioned a new term and that is Fontanel. What exactly is this? Let's find out in the next discussion, and that is unique features of a neonate or fetal skull. The unique features include 1. Presence of fontanelles. Fontanelles are the edges of the bones of the calvarium which have not fully ossified, therefore making the junction of sutures appear wider. These are only found in neonates. There are 2 paired and 2 unpaired fontanelles. The largest is the frontal fontanelle, which is diamond-shaped and found at the junction between the sagittal and coronal suture. It becomes the bregma later in life. It is important because it can tell us the intracranial pressure. For example, when the intracranial pressure is high, it will bulge, such as in people with meningitis and hydrocephaly. When it's sunken, it means there is decreased intracranial pressure, and we may notice that in children who are dehydrated. The anterior fontanelle is also used as an acoustic site to perform cranial ultrasound. Other fontanelles include the posterior fontanelle, sphenoid and mastoid fontanelle, which are paired. Other unique features include wider and more sutures, such as the metopic suture in the frontal bone and the mention as well. Furthermore, there are unilaminar calvarial bones as opposed to having 2 plates and a diplo. There are prominent frontal and parietal tuberosities as shown. Relatively large orbits and small viscerocranium. This may be due to unerupted teeth and absence of alveolar processes. Ununited bony parts such as the various parts of the temporal bone aren't joined together yet, and finally short, straight and wholly cartilaginous external acoustic meatus as opposed to in adults, which is longer, S-shaped and has both a cartilaginous and bony part. It is also important to note the main regions of the fetal skull such as the face, brow, vertex and occiput as shown. These parts are important during childbirth. The vertex presentation is the best type of presentation of the fetal head during childbirth. Next, we shall discuss the cranial cavity. When you cut the skull and remove the calvarium, you'll be able to see the cranial cavity. The cranial cavity houses the brain, the cranial meninges, cranial nerves, blood vessels and cerebrospinal fluid. The base of the cranial cavity is divided into 3 distinct fossae: the anterior, middle and posterior cranial fossae. When we discuss the fossae, it's important to note their borders and content. Let's begin with the anterior cranial fossa. The anterior cranial fossa consists of 3 bones: the frontal bone, ethmoid bone and sphenoid bone. It is bounded as follows. Anteriorly and laterally it is bounded by the inner surface of the frontal bone. Posteriorly and medially it is bounded by the limbus of the sphenoid bone. The limbus is a bony ridge that forms the anterior border of the prechiasmatic sulcus, a groove running between the right and left optic canals. Posteriorly and laterally it is bounded by the lesser wings of the sphenoid bone. These are 2 triangular projections of bone that arise from the central sphenoid body. The floor consists of the frontal bone, ethmoid bone and the anterior aspects of the body and lesser wings of the sphenoid bone. Its contents include the frontal lobes of the brain and the olfactory bulb and tract. Note: the cribriform plate of the ethmoid is the thinnest part of the anterior cranial fossa, and therefore most likely to fracture. There are 2 major consequences of cribriform plate fracture. Anosmia: the olfactory nerve fibers run through the cribriform plate, and can be sheared, resulting in loss of sense of smell. 2. CSF rhinorrhea: the fragments of bone can tear the meningeal coverings of the brain, causing the leakage of cerebrospinal fluid into the nasal cavity. This is visible as a clear fluid. Quick quiz: which bone makes up the majority of the lateral boundary of the anterior cranial fossa? Frontal bone, ethmoid bone, sphenoid bone, parietal bone. The correct answer is frontal bone. We proceed to the middle cranial fossa. The middle cranial fossa consists of 3 bones, the sphenoid bone and the 2 temporal bones. Its boundaries are as follows. Anteriorly and laterally it is bounded by the lesser wings of the sphenoid bone. These are 2 triangular projections of bone that arise from the central sphenoid body. Anteriorly and medially it is bounded by the limbus of the sphenoid bone. The limbus is a bony ridge that forms the anterior border of the chiasmatic sulcus, a groove running between the right and left optic canals. Posteriorly and laterally it is bounded by the superior border of the petrous part of the temporal bone. Posteriorly and medially it is bounded by the dorsum celli of the sphenoid bone. This is a large superior projection of bone that arises from the sphenoidal body. The floor is formed by the body and greater wing of the sphenoid, and the squamous and petrous parts of the temporal bone. The contents of the middle cranial fossa include temporal lobes of the cerebrum, pituitary gland, cavernous sinuses and cranial nerves 2 to 6. Lastly, the posterior cranial fossa. The posterior cranial fossa is comprised of 3 bones, the occipital bone and the 2 temporal bones. It is bounded as follows. Anteromedial, dorsum celli of the sphenoid bone, large projection of bone superiorly that arises from the body of the sphenoid. Anterolateral, superior border of the petrous part of the temporal bone. Posterior, internal surface of the squamous part of the occipital bone. Floor, mastoid part of the temporal bone and the squamous, condylar and basilar parts of the occipital bone. The contents of the posterior cranial fossa include the cerebellum, the medulla oblongata, the pons, the dural venous. Sinuses and cranial nerves 7 to 12. Quick quiz. Which of the following does not contribute to the floor of the posterior cranial fossa? Mastoid part of the temporal bone, petrous part of the temporal bone, condylar part of the occipital bone, the basilar part of the occipital bone. The correct answer is petrous part of the temporal bone. The next subtopic of discussion is the relevance of the skull. 1. The skull is used in determination of sex. How? The skull of females stop growing earlier compared to male skulls, so the manifestation of muscular attachments are more pronounced on the skull of males than on the female skull, so the prominences would be used to identify a male skull. 2. It is used to determine the chronological age of a person. This is based on the fact of skeletal maturity, that is to say, which bones ossifies at which age, which sutures unite at which age, etc. 3. Determination of taste. This is not very accurate, but some people have tried to classify the skull as Negroid, Caucasian, Mongoloids and so on. The skull is also used for facial approximation. Through computer and modeling reconstruction, the skull can be used to identify an unidentified deceased person. Finally, we shall discuss about the skull foramina. A foramen, plural, foramina, is a hole through a bone. When talking about foramina, it is important to note where it is located and what passes through it. The largest foramen is referred to as the foramen magnum. It traverses the brain stem or spinal cord, the meninges around the brain stem and spinal cord. It also traverses the vertebral arteries as they enter from the neck into the cranial cavity, the spinal accessory nerve, cervical meningeal nerves and the cerebrospinal fluid. Other foramina of the skull include cribiform plate for passage of olfactory nerve, optic canal for passage of optic nerve, superior orbital fissure for passage of 3 nerves, oculomotor nerve, ophthalmic nerve and abducens nerve, foramen rotundum for passage of maxillary nerve, foramen oval for massage of mandibular nerve, internal acoustic meatus for passage of facial and vestibulocochlear nerve, jugular foramen for passage of glossopharyngeal, vagus and accessory nerve, and finally the hypoglossal canal for passage of hypoglossal nerve. Here's the final quiz. The optic canal is a foramen in which bone of the skull? Ethmoid, sphenoid, temporal, occipital. The correct answer is sphenoid bone. In summary, we've talked about the functions of the skull, the cranium, the sutures of the skull foramina, the cranial cavity and the relevance of the skull. That's it. Next, we'll talk about the scalp and face and then we can discuss about the brain. Thanks for watching. Subscribe to Anatomy Movement YouTube channel for more funatomy.